Pay for the drug or face death from cancer.
Money or your life. That is the choice a Houston mother had to make. Her insurance company refused to pay for a cancer drug that her doctor said she needed. Well, that was bad enough, but then that mother was forced to pay nearly 3 times the price for the very same drug that her insurance company would not cover. And she is far from the only person being treated this way. Channel 2 investigator Bill Spencer is exposing how insurance companies and hospitals are getting away with it, and he's revealing the new push to protect patients.
Her entire career, nurse Anne Marie Callahan has worked toward just one mission: saving other people's lives.
I'm going to take great care of you.
But then, 3 years ago, Anne got some of the worst news any woman will ever hear. You have stage 3 breast cancer.
I'm going to start crying. I just cry when I talk about it.
All Anne could think about was her husband and 2 daughters and not being there.
I was pretty sure I was going to die, so I didn't think I was going to be around and see him anymore.
But with help from world-renowned doctors at the Baylor College of Medicine, Anne Marie beat that killer cancer. But then this past summer, it came back. Anne's doctors told her her best chance for survival was a new, expensive cancer drug called Perjeta.
Is this something I have to do? She said, absolutely. And if you do it, I think you're going to live to be an old lady.
$61,000.
The only problem, Perjeta is incredibly expensive. A single dose, 420 milligrams, can be bought directly for about $5,000. Medicare pays about $4,300, and insurance companies can pay a negotiated rate of about $4,100. But Anne's insurance company, Blue Cross Blue Shield of Texas, refused to pay for that drug, calling it experimental, investigational, saying there is insufficient evidence establishing the service is generally accepted in the medical community.
Pay for the drug or face death from cancer. Your money or your life.
Even worse, not only would Anne have to pay for that drug out of her own pocket, the hospital told her she'd have to pay almost 3 times more than the insurance company and double what you'd pay at a specialty pharmacy.
The insurance company pays for 1 dose, the 420 milligrams, around $4,100.
What were you forced to pay?
$12,200.
The system itself is rigged against patients.
Sean Fry, a medical billing consultant who works with hospitals all over the country, calls it ridiculous.
It is absolutely outrageous that a woman who has insurance benefits through this plan not be allowed the right to exercise those benefits. I mean, that's the whole purpose of why we have insurance.
I think it's horrible.
Now, to put an end to drug price nightmare stories like Anne Marie's, Texas Congressman Lloyd Doggett has just launched the Affordable Drug Task Force, aimed at greatly lowering the cost millions of Americans are forced to pay for life-saving, life-improving drugs.
The first problem we're trying to deal with on our task force is why it is that particularly cancer drugs, but for really any multiple sclerosis, any dread disease, are being priced so high. It really is banditry when it's your money or your life.
I'm going to give you a little oxygen to breathe, okay?
As for Anne Marie, she paid for that drug to stay alive. A total of $61,000 for 5 doses.
I really want it. I want it to stop. I want this whole thing exposed because it's not just me, it's everywhere.
Now, we asked Blue Cross Blue Shield for an on-camera interview so that we could ask questions about all this, to ask why they denied coverage in this case. We asked Baylor to explain why it charged Anne so much more than she could have bought the drug for on her own. Both refused. Blue Cross Blue Shield said in a general statement to us, such determinations are made under the direction of a Blue Cross Blue Shield of Texas medical director based on applicable medical policy. Baylor wrote, pricing for drugs and clinical services outside of insurance is a complicated matrix. We are confident that our pricing is at or below other healthcare institutions. Stay tuned, everyone. We are not through with this issue.
You know, it is infuriating, and our heart goes out to Anne Marie. It really does. Is there any takeaway that we can all glean from this so that we don't find ourselves in a similar situation?
Yeah, Sean, our medical billing expert, has like 3 different tips to give everybody. Number 1, ask your doctor to go to bat for you, to argue for you with the insurance company if they refuse to pay. Also, get a letter of medical necessity. And third, appeal the insurance company's denial all the way. That is what Anne is doing. She is still fighting. She has now brought her case before the Texas Board of Insurance.
Good for her.
Good story, Bill.